So guys, I need you to watch this video.
Effects of these hormone treatments long term? Do we know even?
Well, there's the rub. Dr. Hilary Cass, who led the review, has identified there are potential problems. And one of the issues is there is not enough evidence to really know the long-term effects. But we do know there are potential risks of infertility, of bone loss, of muscle loss. There are risks to the developing brain. There are also risks with these cross-sex hormones of cardiovascular disease, so heart disease, and also diabetes. But a lot of this is unknown territory. And in fact, there are trials going on with the puberty blockers, the drugs that are used to stop puberty happening, to see what the risks and benefits are. But when you don't know the risks and benefits of a drug, the rule is really not to use them because you need to know first. So this is the worry. And the case is being brought. One of the litigants is called Kira Bell, and she's been very brave and very outspoken. We've probably spoken to her before, but she says she's in irreversible problems, and she's got facial hair and all sorts of problems now because she went through a detransition. She's trying to detransition now.
Now, one major key point I'm going to pick from there is if you don't know the effects of the effect, that's the positive and the side effects of a drug, it's best not to use it. Okay, one major thing that I would pick from that is if you don't know the effects of a drug, it's best not to use it. You know, when the current president placed a ban on this movement, the rainbow movement and the likes, and many people came out to say a lot of words and all that against him. So at the end of the day, he's even trying to help them because all they are after is the puberty blockers that these things promise, and they don't know there's a lot of side effects that comes from it. I mean, it reduces the users to, it makes them lesser than humans, affects their bones, potential heart disease risk, diabetes and infertility and so many other things. So now couple it with the fact that they are pushing most of these things to little children that don't know how to ask the right questions, to the younger folks that don't really know what they are doing. You understand? So this is like, and it's at the end of the day, it boosts or it fulfills the agenda of the elites, that's the big people, because they are after reducing the population of the world. So once somebody uses these puberty blockers because you want to become what you're not, then at the end of the day, you find out that you lose more than you gain. So, and there have been stories of people now that now move from transition to detransitioning. But after you detransition, can you still be whole as you were before transitioning? So that's it, guys. That's why we keep creating this awareness. Say no to these things and don't bring them closer to our kids. I mean, I saw a protest and people were like, my body, my uterus, say no to it. No, we're not hating on you guys. We're just trying to save you from yourself and of course save our kids, save you from polluting. I mean, before everybody was like, I mean, the bigger majority, we all felt it's not our business, it's their body. But then with the emergence of the MAPs and the likes, then we know it's not just about them, because it affects the society at large. Because if somebody claims to be an MAP and wants to satisfy their lustful desires, they have to pick and do nasty things to somebody's little one, and it could be anybody's little one. So we don't want that. That is why we are speaking against things like this. Yep, that's it.